It's pretty shocking, when you hear that violence leads to the death of 18 women globally every single day.
Yeah.
And, it's estimated that like 1 in 3 American women will experience violence in their lifetime. Those numbers really make you stop and think. I mean, this is a huge public health and human rights issue, but we don't always talk about it as much as we should.
Absolutely. And you're right. It's not just limited to certain groups or anything.
Right.
Violence and abuse, unfortunately, they touch people from all walks of life. Socioeconomic levels, race, communities, it doesn't matter. It's way more common than people think, I think.
That's why I'm so glad we're doing this deep dive today, especially for everyone listening. Those of you in training to be healthcare professionals are already out there practicing.
Right.
It's something you will almost certainly encounter, regardless of your specific path. People affected by violence, right?
Yeah.
I mean, nurses especially are often the first point of contact.
Absolutely. You're the first line. Often, yeah. And recognizing the signs, knowing how to ask the right questions, and doing it with sensitivity and offering support, that can make a world of difference to someone who's been through something like that. So today, we're going to cover a lot of ground. We're going to talk about intimate partner violence, or IPV, sexual violence, including things like sexual abuse and rape, and then we'll get into some other issues like female genital cutting and the realities of human trafficking.
Okay, let's jump right in with intimate partner violence, IPV. What are we really talking about when we use that term?
So IPV basically covers any actual or threatened physical or sexual violence. It also includes any psychological or emotional abuse that happens within an intimate relationship, whether current or past.
Okay.
You might hear other terms too, like domestic abuse, spouse abuse, relationship abuse. They're all kind of pointing to the same kind of harmful behaviors.
And this is a really widespread problem, isn't it?
It's really sad how common it is. We're talking about over 44 million adults in the U.S. who experience IPV in their lifetime. Think about that. Every minute, 20 people in the U.S. are dealing with rape, physical violence, or stalking by an intimate partner. And while men can be victims too, it's mostly women who are affected. The financial impact on the U.S. is huge. I mean, we're talking trillions of dollars annually when you factor in things like healthcare costs, lost productivity, and legal expenses, and the human costs. That's impossible to measure. Thousands of women die each year because of IPV, and millions are injured.
Those numbers are just staggering. It really highlights how big of a problem it is. And it's not limited to any particular stage of life either, is it?
Not at all. Women can experience violence at practically every stage of life. And it's a scary thought, but current or former intimate partners are responsible for more than half of all murders of women in the U.S. When you compare it to other dangers, IPV against women results in more serious injuries and deaths than car accidents, rape, and muggings put together.
Wow. That's a really disturbing comparison. And it's not limited to any specific group of people, right?
Right. It crosses all boundaries. Sexual orientation, race, socioeconomic status. It doesn't discriminate. Historically, a lot of the focus on IPV has been on heterosexual women. But research is showing that the prevalence of IPV in the LGBTI community is just as high, and the negative health impacts are just as bad. So nurses have a really important role to play in advocating for everyone in these communities, especially since they might face more challenges in getting help.
I think it's easy to think of this as a modern issue, but isn't understanding the historical context important too?
Yeah, absolutely. It wasn't that long ago, really, just the mid-20th century, when society kind of accepted a man's authority and control in a relationship. It wasn't unusual for law enforcement to avoid getting involved in what were considered family matters. So there was a lot of tolerance for IPV back then. Thankfully, things have changed. We've seen significant shifts in societal attitudes and legal protections, all aimed at keeping victims safe and making abusers accountable for their actions.
Right. This change is reflected in public health initiatives like Healthy People 2030, which has specific goals to prevent all sorts of violence, including IPV and sexual violence. They're looking at all age groups too.
That's good to hear. So when we look at who is most likely to be the abuser in these situations, are there specific risk factors that make someone more prone to committing IPV?
Yeah. Research has pinpointed a few things. They can be grouped into 4 categories: individual, relationship, community, and societal. So looking at individual factors, you might see things like being young, certain personality traits, depression, or maybe excessive alcohol use.
In terms of relationships, frequent arguments are a red flag, along with a history of family conflict, cohabiting relationships, or infidelity. And then at the community level, things get more complicated. Weak law enforcement against IPV can contribute, along with limited social support networks and economic hardship. And then, on a larger scale, societal factors play a part. You're talking about traditional gender roles, social norms that kind of condone violence, and this whole idea of male dominance. It all feeds into the problem.
It seems like a lot of factors can come into play, unfortunately. And we often hear about this cycle of violence in abusive relationships. What exactly does that look like?
It usually plays out in 3 phases. The first is the tension-building phase, and this one can drag on for a while. Communication breaks down, you get more frequent arguments, and there's just this overall sense of unease.
Yeah.
Things like increased alcohol use or jealousy can really fuel the fire, leading to verbal attacks and more friction. The woman often picks up on her partner's negativity and might try to avoid triggering an outburst. It's a lot of internalized tension and feeling like she has to keep the peace.
That must be so draining to live with constantly. What happens next?
Well, eventually, that tension reaches a breaking point. That leads to the second phase, the acute battering phase. This is where it turns physical. The abuser loses control, both physically and emotionally, and the victim is assaulted. Sadly, after the episode, victims often downplay the severity of their injuries, sometimes even refusing medical help.
And then there's often that period of calm afterward, right? The so-called honeymoon phase.
Exactly. In that third phase, things quiet down. The abuser might become apologetic, remorseful, maybe even affectionate. They might truly believe they can change and try hard to convince the victim of that. Of course, the victim wants the abuse to end, so she often wants to believe it too. But tragically, over time, this honeymoon phase gets shorter and shorter, and eventually it disappears altogether. The abusive episodes become more frequent, more severe, and the abuser no longer feels the need to reconcile. And that's the truly insidious part, isn't it? It's not just the physical abuse, but the way that honeymoon phase gives a false sense of hope, reinforcing the victim's emotional dependence and making it so much harder to leave.
Yeah, that manipulation is just heartbreaking to think about. And it's important to remember that abuse isn't always physical, right?
Definitely. There are many forms of abuse. You have emotional abuse, which can involve threats, humiliation, isolation, and all sorts of controlling behavior. For example, constantly putting someone down or isolating them from their loved ones are very real and harmful forms of abuse. Physical abuse, as we talked about, is the most obvious. It includes hitting, grabbing, throwing things, slapping, biting, burning, choking, you name it. It can even involve controlling access to health care. Financial abuse is another form, where someone might prevent their partner from working, sabotage their job, control all the money, or just not contribute financially to the household. And then there's sexual abuse, which involves any forced sexual contact without consent, as well as degrading or humiliating sexual acts.
It seems like there are a lot of misconceptions surrounding IPV. What are some of the myths we need to dispel?
Oh, there are so many. There's this idea that IPV only happens in lower socioeconomic classes, but that's not true at all. It affects people across all income levels. Another myth is that substance abuse is the root cause of IPV. While alcohol and drugs can certainly make things worse, violence is ultimately a choice, a learned behavior.
Right.
Then there's this outdated notion that men have the right to discipline their partners. That's just dangerous and wrong. Physical abuse is a crime, plain and simple. And another misconception is that IPV is rare. Sadly, that couldn't be further from the truth. A significant portion of women will experience it in their lifetime. And contrary to what some people think, leaving an abusive relationship isn't easy. In fact, it can be the most dangerous time for a victim.
That's a terrifying thought.
Another myth is that only men with mental health issues are abusers. Many abusers actually seem perfectly normal, and unfortunately, pregnancy doesn't offer any protection. Studies show that a large number of women experience abuse during pregnancy. And finally, this idea that women provoke their partners to abuse them is simply not true. No one deserves to be abused no matter what.
It's so important to debunk those myths. Understanding the characteristics of both victims and abusers can also be very helpful for healthcare professionals. What might a nurse observe in those situations?
Victims often don't come right out and say they're being abused. They might feel trapped, helpless, isolated. They might avoid any sign of anger from their partner. Some even believe they're to blame for the abuse. It's heartbreaking. And a lot of them have experienced abuse in childhood, which can lead to low self-esteem, poor health, PTSD, depression, and even substance abuse.
Oh, yeah.
On the other hand, abusers often feel insecure and powerless, but they try to project an image of control. They use violence to manipulate and control their victims. Their behavior can be almost childlike in its aggression, and they always blame others for their problems.
Interesting.
You might also see a history of substance abuse, legal issues, not many close relationships outside of their partner, and a lot of jealousy and controlling behavior.
Speaking of pregnancy, we need to specifically address violence against women during that time because it's considered a period of increased vulnerability.
Right. Absolutely. Pregnancy is usually such a happy time, full of excitement and anticipation. But for women in abusive relationships, it can be incredibly dangerous. Having experienced abuse before is the biggest predictor of abuse during pregnancy. It's shocking, but the number of women abused during pregnancy seems to be higher than the rates of some conditions we routinely check for in prenatal care. And there are several risk factors to watch out for. Difficulty coping with stress, being young, lack of education, unemployment, jealousy from the partner, an unplanned pregnancy, even the woman's focus shifting towards the baby. The consequences can be awful for both the mother and the unborn child, including physical injuries, depression, even fetal death, premature birth, and low birth weight. That's why it's so important to screen for IPV at every single prenatal visit.
And sadly, the abuse doesn't always stop as women get older. We should talk about violence against older women, too.
Elder abuse is a big problem, and it often overlaps with IPV. Older women can experience all the same forms of violence as younger women, but ageism, sexism, illness, disability, social isolation, being widowed, all of those things can make them more vulnerable. And elder abuse often goes unreported. The signs can be subtle, like unexplained depression, insomnia, or chronic pain. In many places, healthcare providers are legally required to report suspected elder abuse, so it's important to be aware of those laws.
So, for nurses who think they might be dealing with a victim of IPV, what are the most important steps to take?
First and foremost, you need a comprehensive assessment. Screening for IPV should be part of every healthcare visit, no exceptions. It's all about building rapport with the patient, listening attentively, showing genuine concern. And you need to be on the lookout for clues. Unexplained injuries, inconsistent stories about those injuries, signs of mental health problems, a partner who seems too controlling or speaks for the patient. If you think abuse might be happening, it's crucial to interview the patient alone, away from their family or partner. That way they feel safer and more likely to open up.
All right, that makes sense.
Ask direct questions, but also some indirect ones, about potential abuse. Do it with empathy and without judgment. There's a helpful framework to remember, SVE, that stands for Screen Routinely. Ask direct questions if the screening suggests risk, validate the woman's experience, and evaluate her safety and provide education and referrals.
Okay, SVE. I'll try to remember that. And safety is obviously a huge concern. How should a nurse go about assessing that?
You're right, safety comes first. Ask directly if she feels safe going home, if she has a safe place to go if needed, if she has an escape plan, and who she can reach out to for support. There's a tool called the Danger Assessment Tool that can be really helpful. It looks at things like the frequency and severity of past abuse, whether there are weapons involved, and any threats to kill. This tool can help you figure out if there's a risk of things escalating, even the potential for homicide.
And what about documentation and reporting? Are there any legal obligations there?
Documentation is incredibly important. You need to be thorough. Record the frequency and severity of the abuse, the specific location and nature of any injuries, and all the details of any treatment provided. Use the woman's own words whenever you can, and be as precise as possible. A body map can be useful for visually documenting injuries, and photographs should be taken, but always with the patient's informed consent. And be sure to know the legal requirements in your area about reporting certain injuries, especially those involving weapons or that look like they were caused by assault.
Makes sense. Once the assessment is done, what are some of the nursing diagnoses and interventions that might come into play?
Well, some relevant nursing diagnoses could include deficient knowledge, about the cycle of violence and the resources that are out there, along with anxiety, low self-esteem, feelings of powerlessness, and ineffective coping mechanisms. Right. Nursing interventions should focus on active listening, communicating belief in the woman's story, validating her experiences, and really emphasizing that violence is never okay. The main goal is to empower her, to help her regain control over her life. And remember the ABCDES framework. Assure her she's not alone, believe her, maintain confidentiality within the limits of the law, document everything accurately, educate her about the cycle of violence and resources available, and make her safety the top priority. You should also give her all the information about community services that are available, offer emotional support, and help her create a safety plan for leaving the abusive situation when she's ready. That plan should include figuring out what essential items to take and how to stay safe when she leaves.
All right, now let's shift gears and talk about another serious problem. Sexual violence.
Yeah.
How big of an issue is this, and what kind of impact does it have?
Sexual violence is a global problem, and it's rooted in gender inequality. It's a public health crisis, and it's a violation of human rights. It's estimated that 1 in 3 women worldwide will experience sexual violence in their lifetime. In the U.S., a sexual assault happens about every 73 seconds, and women are the primary targets. And here's the sad part. It's one of the most underreported crimes out there. The consequences are devastating, both immediately and in the long run. We're talking chronic pain, STIs, anxiety disorders, PTSD, and a huge impact on self-esteem and how well someone can function in their daily life. Globally, the numbers are even more alarming. A huge number of children under 18 have experienced some form of violence, including sexual violence, and this can have lifelong consequences.
Are there any specific characteristics that identify people who commit sexual assault?
You know, people often think there's a certain type, a profile of a sexual assailant, but the reality is that they come from all walks of life, all backgrounds.
Oh, interesting.
Over half of them are younger than 25, and a lot of them are actually in committed relationships. And it's important to understand that sexual assault isn't really about sexual desire. It's about power and control.
I see.
A lot of these perpetrators feel inadequate, they have trouble controlling their anger, they see women as unequal, they have volatile tempers, and they constantly need their masculinity validated.
That's pretty insightful. And what about sexual abuse? That's a particularly horrifying form of violence. What does that encompass?
Sexual abuse involves any kind of forced sexual contact without consent. It's a hidden problem, especially when kids are involved. It's estimated that about 1 in 5 girls experience sexual abuse, and it most commonly happens between the ages of 8 and 12. And in most cases, the abuser is someone the victim knows and trusts, which makes it even more tragic.
Right.
This kind of abuse leaves deep, lasting scars and dramatically increases the victim's risk of being abused again later in life.
And then there's incest, another terrible form of abuse that happens within families.
Yes, incest is sexual activity between close relatives where marriage is forbidden by law or culture. It's not just a crime, it's a sign of serious dysfunction in the family. Adult survivors of incest often struggle with low self-esteem, have trouble building healthy relationships, experience sexual problems, and may suffer from flashbacks, nightmares, and an increased risk of suicide and substance abuse. And these victims are often manipulated, coerced, threatened into silence. They're terrified to talk about what's happening.
That's just awful. And what about rape? I think we often hear that term, but it's important to be clear about what it means in this context.
Right. Legally, rape is defined as any penetration, no matter how slight, of the vagina or anus with any body part or object or oral penetration by someone else's sex organ without consent. It's really important to understand that rape is an act of violence and control, not about sex. It's driven by anger, a need for power, and a desire to dominate another person. Then you have statutory rape, which is sexual activity with someone who is legally too young to consent. In those cases, consent doesn't even matter because a minor can't legally give it.
It seems like there are a lot of myths and misconceptions around rape, just like with IPV.
Yeah, there are so many. One common one is that women who've been raped will get over it quickly. But healing from that kind of trauma takes time. It's a long and difficult journey that can last for years. And most rape victims never even report it to the police, and even fewer tell anyone at all about what happened. It's also a myth that once the physical assault is over, the survivor feels safe. Often they feel vulnerable and scared for a very long time.
I can only imagine.
And then there's this awful idea that if a woman truly resists, rape can't happen. But the truth is that women can be overpowered and forced. And this notion that women who regret consensual sex just make up rape accusations is really damaging. False rape accusations are actually very rare. And while we wish every victim would report the crime, less than 10% of rapes actually lead to an arrest. And dealing with the legal system can be re-traumatizing for survivors.
Oh, wow. I didn't know that.
Then you have victim blaming, this idea that a woman's behavior, clothes, or lifestyle somehow provoked the rape. That's just wrong. No one asks to be raped. And the idea that men can get so aroused that they can't stop themselves is also false. Everyone has the ability to make choices about their actions. And remember, anyone can be a target of sexual assault, regardless of how they look.
That's such an important point.
While immediate medical care is crucial, Long-term counseling and therapy are essential for healing. It's not about erasing the memory, but helping the survivor cope and live a full life.
And what about acquaintance rape, which includes date rape? That seems to be a particular problem on college campuses.
Acquaintance rape is when someone is forced to have sex by someone they know, like a friend, classmate, coworker, or someone they're dating. It's shockingly common and probably makes up most reported rapes, especially on college campuses. Unfortunately, many women experience it, but most don't report it. The trauma from acquaintance rape is often just as bad as what survivors of stranger rape experience. One of the biggest problems is that people often don't understand or clearly communicate about consent, and that can lead victims to blame themselves for what happened. And the use of date rape drugs, things like Rohypnol, GHB, and ketamine, is another serious problem. We need to educate people about how to protect themselves, like never leaving drinks unattended and being careful about accepting drinks from others.
Those are really good points. And what about the recovery process after a rape? That must be a long and difficult road.
Survivors of rape typically go through 4 phases, and they often overlap. The first is the acute or disorganization phase. This is where the initial reactions to the trauma hit: shock, fear, disbelief, anger, all sorts of physical symptoms. In the second phase, called outward adjustment or denial, the survivor might seem like they're coping, but they're often avoiding dealing with the emotional impact of the assault. In the third phase, reorganization, the survivor starts to acknowledge and process the trauma, tries to make changes in their life, and uses coping mechanisms. Finally, in the integration and recovery phase, the survivor starts to feel safer, rebuilds trust in others, and might even become an advocate for other survivors. It's important to remember that a lot of rape survivors develop PTSD, with symptoms like intrusive memories, avoiding things that remind them of the trauma, being easily startled, and changes in their mood and thinking.
That's a lot to process. For nurses caring for rape victims, what are the most important things to keep in mind?
The role of healthcare providers, especially sexual assault nurse examiners or SANEs, is so important. The priority should be to provide compassionate, supportive care in a safe and private setting. Let the survivor tell their story if they choose to, and you need to carefully collect and document any forensic evidence. Tell the survivor not to shower, bathe, or change clothes before the forensic medical exam, if at all possible. It's also important to check for STIs through a pelvic exam and offer preventive treatment. You should also provide information about and access to emergency contraception to prevent pregnancy. And don't forget to screen for PTSD symptoms by asking direct but sensitive questions about intrusive thoughts, avoidance behaviors, and physical signs of anxiety. Give the survivor information about local crisis centers, mental health professionals, and support groups. Early intervention and access to counseling can make a huge difference in their recovery.
Okay, now let's talk about another form of violence against women that's a bit different but equally concerning. Female genital cutting, or FGC. Can you explain what it is and how common it is around the world?
Female genital cutting, sometimes called female genital mutilation or female circumcision, includes any procedure that involves partially or completely removing the external female genitalia or any other injury to the female genitals for non-medical reasons. It's a deeply rooted practice in some cultures, mainly seen as tradition rather than having any health benefits. The international community recognizes FGC as a violation of human rights and a serious health risk for women and girls. There are 4 main types, ranging from removing part or all of the clitoris to narrowing the vaginal opening by cutting and stitching together the labia. It's a global problem, affecting around 200 million women and girls alive today, with millions more at risk every year. It's mainly concentrated in about 30 countries in Africa, parts of the Middle East, and Asia.
What are the reasons behind this practice?
The origins of FGC are unclear, and it's not required by any major religion, even though it's become ingrained in the cultural traditions of many communities. The reasons for continuing the practice are complicated. It's often seen as a rite of passage for girls, a way to ensure they stay virgins before marriage and remain faithful after marriage, and as a way to improve a girl's chances of getting married and maintain her family's honor. Even though it causes so much harm, there's immense social pressure within these communities to conform.
And the health complications are serious, right?
Yes, they can be devastating, both right after the procedure and in the long term. Immediate complications can include severe pain, bleeding, infection, fever, shock, and even death. Long-term problems can involve a whole range of physical, psychological, and sexual health issues: infertility, recurring UTIs, painful periods and intercourse, cysts, abscesses, problems during childbirth, an increased risk of obstetric fistula, and a lot of psychological trauma like anxiety, depression, PTSD, and low self-esteem.
With so much migration happening globally, Healthcare professionals in many parts of the world are encountering more women and girls who have undergone FGC. What's the best approach for nurses in these situations?
The key is to be culturally sensitive, respectful, and communicate well. This might mean using interpreters. Remember, in many communities where FGC is practiced, it's seen as normal and part of their tradition. Nurses should focus on providing accurate information and making sure these patients have a positive healthcare experience. Don't judge or condemn the practice. Use respectful language and the terms the patient uses to describe it. Including female family members in health education can also help. The main goals are to provide culturally competent care, maintain confidentiality, and understand that even though we respect cultural beliefs, FGC is a form of violence against women and girls. Real change will come through education, empowerment, and working with communities. When caring for patients who've had FGC, ask open-ended questions about their health concerns, be aware of potential complications during gynecological exams and childbirth, and provide appropriate care without judgment.
Now let's talk about another terrible crime, human trafficking. What is it, and how big of a problem is it both globally and in the U.S.?
Human trafficking, according to the United Nations, is the recruitment, transportation, transfer, harboring, or receiving of people by using force, threats, coercion, abduction, fraud, deception, abuse of power, or taking advantage of someone's vulnerability. It can also involve giving or receiving payments to get someone's consent to exploit another person. This exploitation includes forcing people into prostitution or other sexual acts, forced labor or services, slavery or practices similar to slavery, servitude, or removing organs. It's a global problem, a modern form of slavery that affects millions of people worldwide. In the U.S., forced labor and sex trafficking are a big problem in various sectors, including the sex industry, domestic work, agriculture, and the hospitality industry. It's estimated that tens of thousands of people are trafficked into and within the U.S. every year. Women and children are especially vulnerable. This criminal enterprise makes huge profits, fueled by things like poverty, lack of education and economic opportunities, and social instability. It's a very lucrative illegal industry, bringing in billions of dollars in profits globally.
What kind of things do victims of human trafficking go through?
Victims of human trafficking are subjected to horrifying things: rape, sexual violence, physical and psychological torture, threats against themselves and their families, and debt bondage, where they're forced to work to pay off debts that are often made up or inflated. They face serious health risks because of the terrible conditions they're forced to live in, including physical injuries, STIs, malnutrition, dehydration, and severe psychological trauma. Traffickers often take away their identification documents and isolate them from their families and support networks, making it incredibly hard to escape or get help.
Terrifying to think about. Nurses and other healthcare providers might encounter victims of human trafficking without realizing it. What are some signs they should look out for?
All healthcare professionals need to be alert for potential signs of trafficking. Keep an eye out for things like poor physical or mental health, being a foreigner who doesn't speak English or speaks it poorly, lacking ID, seeming afraid, anxious, or submissive, avoiding eye contact, being reluctant to undress for a medical exam, giving inconsistent or vague explanations for injuries, being accompanied by someone who seems controlling or won't leave them alone with the healthcare provider, and living and working at the same place. There are also specific questions you can ask privately, like if they're free to leave their job or living situation, if they have their own ID, if they're being paid for their work, and if they ever feel afraid of their employer or the person they live with.
So if a nurse thinks they might be dealing with a trafficking victim, what should they do right away?
The most important thing is to build trust and keep the person safe. Be aware of at-risk groups in your community and pay attention to how the patient interacts with anyone who came with them. If you're concerned, try to screen the patient in private. Let them know you're there to help and do a thorough medical exam looking for any signs of abuse or neglect. Address their immediate medical needs, listen carefully to what they say and don't say, and paraphrase to make sure you understand. Document your observations and any suspicions carefully and discreetly. And most importantly, don't try to confront the suspected trafficker. Call the National Human Trafficking Hotline right away for guidance and support. They can provide valuable resources and connect you with local law enforcement and social services that are equipped to handle these difficult and dangerous situations. Your role in recognizing and reporting potential trafficking cases can literally save lives. The hotline number is 1-866-US-TIP-LINE.
This has been a really important, though difficult, deep dive into the many forms of violence and abuse that women face. What would you say are the most important things for our listeners to take away from this conversation?
The main takeaways are that violence against women is a widespread, serious human rights and public health issue. It has devastating and long-lasting effects on individuals, families, and whole communities. It takes many forms, including intimate partner violence, sexual violence, female genital cutting, and human trafficking. Nurses, no matter where they work, are on the front lines. They play a vital role in recognizing the often subtle signs of abuse, doing sensitive and thorough assessments, providing crucial support, and connecting survivors with the resources and help they need to be safe.
As current and future healthcare professionals, you have the power to make a real difference in the lives of those affected by violence. Use your knowledge, your skills, and your compassion to provide the best possible care.
Knowing how profoundly violence affects people, what will you do in your future practice to be a force for positive change and healing in the lives of those who have experienced such harm?